Hi, I'm Nicole Cutler, a licensed acupuncturist and holistic health advocate. Hepatitis C affects millions of Americans, yet it remains one of the most poorly understood diseases. This is why I'd like to discuss the top 10 hepatitis C myths. Myth number 1. You can get hepatitis C from drinking too much alcohol. Simply put, this is not true. Hepatitis C is caused by a virus. However, drinking alcohol will make hepatitis C infection worse. There is a different type of hepatitis called alcoholic hepatitis. That is a consequence of drinking alcohol. Myth number 2. If you have been vaccinated for hepatitis, you don't need to worry about hepatitis C. Unfortunately, there is not yet a vaccine for hepatitis C. There are separate vaccines for hepatitis A and hepatitis B, but these do not offer protection against hepatitis C. Myth number 3. Hepatitis C is a sexually transmitted disease. Although it is technically possible to spread hepatitis C through sexual contact, if infected blood is passed between partners, this does not happen very often. Since only a small percentage of hepatitis C infections are believed to be acquired through sex, hepatitis C is not considered a sexually transmitted disease. Myth number 4. Hepatitis C is a death sentence. Even though this illness does not yet have a guaranteed cure, there are so many ways to affect your odds when living with hepatitis C. The truth is, hepatitis C can destroy the liver in just a few years, or someone can have the virus for over 60 years without progressing to end-stage liver disease. Myth number 5. If hepatitis C were harming my health, I would have symptoms. Hepatitis C is commonly referred to as a silent killer because it can be an asymptomatic disease. Between 80 and 85% of those with hepatitis C have no signs or symptoms of their infection, and discomfort may not surface until it is too late. Myth number 6. People with hepatitis C are drug users. Even though intravenous drug use is the easiest route to hepatitis C infection, there are many other ways to transmit this bloodborne virus. In fact, up to a third of people diagnosed with hepatitis C cannot identify the source of their infection. Myth number 7. HIV, the virus that causes AIDS, is more prevalent and contagious than hepatitis C. Even though the public knows more about HIV than hepatitis C, Hep C represents a larger health threat because it infects over 4 times more Americans and is 7 times more infectious than HIV. Myth number 8. Hepatitis C medical treatment is always difficult. Even though hepatitis C combination therapy is commonly associated with severe side effects, there are plenty of people who complete their treatment without any problems. In addition, many physicians report that patients who prioritize a healthy lifestyle and practice liver wellness seem to have an easier time completing hepatitis C combination therapy. Myth number 9. A man on hepatitis C combination therapy does not need to worry about getting a woman pregnant. Because the medications cause birth defects and may cause fetal loss, men taking interferon and ribavirin are strictly advised to use 2 forms of contraception during treatment and 6 months following treatment. Myth number 10. Hepatitis C viral load correlates with disease progression. Even though it is logical to assume that a higher viral load will cause hepatitis C to progress more quickly, research does not confirm this. There is no connection between the amount of virus in a person's blood and their degree of liver damage. In fact, a liver biopsy, or equivalent method, is the only reliable way to determine how much the liver has been damaged. Even though hepatitis C is so prevalent, there is still a lack of understanding about this virus. By learning more about hepatitis C and distinguishing between fact and myth, our society will have a better idea of what this illness is all about, how to deal with hepatitis C, and how to protect themselves from this contagious disease.